Hello, Dr. Ellen Cutler here, and I wanted to talk about something that I see in my practice all the time with women is their hair. My hair is falling out, or my hair is not the way it used to be, or my skin is dry and also not as healthy as it used to be, and my nails are breaking and they're not growing like I had when I was younger. What is going on? Why am I losing my hair? It can be very devastating for women, devastating for men too. And I have men who talk to me also about that as well. But the majority of those that I work with are women who come in. And it can be any age. It can be young women. It could be older women, any age. Well, I have found that with any chronic health problem, whether it's losing your hair or it's chronic fatigue or it's respiratory problems, getting to the root of why this is happening is most important, because if you get to the root of it, you can solve it. And you can solve it with this method I developed called ECM, Ellen Cutler method. And I am doing these videos because after many years, I now am going to train healthcare practitioners all over the world how to do ECM, whether they want to do it as an adjunct in their already healthcare practice or exclusively, or use my protocols and what I've learned and researched and seen clinically to be so successful over years and years with thousands of patients, thousands of clients. So why is my hair falling out? It's again very devastating. It could be a number of things, and of course I can't go into all of it in a short video like this, but just give you some idea. You could be sensitive, first of all, to products you use on your hair. That's very easy. And I'm saying sensitive, you reactive. And we call it allergy if you want, but it's different than allergy. It's different because I find it on a very different energetic evaluation or assessment that I have developed, a program and a technique that I developed that has helped thousands of people with helping with their hair. And one of the things I tell the women is you probably won't see the hair will grow, but you know what? The hair will grow because it will stop falling out. That is what is important. So it could be what you put. That's simple. But also it could be other reactivities like foods that you eat or other environmental toxins or hormones. Many women, in fact, most women are sensitive to their own hormones, and of course sensitive to sometimes hormones that they're taking. But hormones are huge for many chronic health issues with women, from something like hair to something like fibromyalgia or other kinds of emotional depression, mood disorders, as well as other fatigue and other kinds of symptoms as well. So it could be that you are sensitive and reactive to your own hormones. Common hormones are progesterone or all the different estrogens as well, or testosterone too. That's secreted by our adrenals and secreted by our ovaries as well. So you can be sensitive to that. You can also be sensitive to the glands. Now, wow, that sounds strange. You can actually be sensitive to your own gland. Yes. It could be on different levels. Again, it can seem very complicated, but once you start working with me, it becomes very obvious. And honestly, a lot of it is something you already know and can say, yes, I knew that. Or you can be sensitive or reactive to a supplement you're taking that actually, yes, can cause your hair to have problems or doesn't look for. Here you think you're taking a supplement, it's great for you, but you could be reactive to that supplement as well. So it could be all those different. It could be that your body's trying to detoxify and it's not detoxifying adequately. You could be sensitive or reactive or not, it's not working as well. When you're reactive to something, it doesn't work. When you're reactive to magnesium, guess what? You could be deficient in it. When you're reactive to calcium or sensitive to calcium, you can be deficient in calcium. We need those minerals for our hair. We need those minerals to support other parts of the body. One of the areas that's really important is you could have digestive problems digesting your food, digestive disturbance. As you know me and you know my work, one of my passions is good healthy microbiome, which supports all different parts of our body, especially our hair, and good, adequate, optimal digestion. And what I use for digestion is digestive enzymes. Everybody needs a digestive enzyme. There even are some digestive enzymes that are in some other herbs that were developed that help with skin and hair and nails. So these are just a few. It could be a pathogen or an old bacteria that you don't have now acute, but you could be still reacting to it, or fungus. There is assortment of different things. And again, what's so different about ECM and what's so unique and what you'll love, it's tailored to the individual. So if Barbara comes in with hair problems or losing her hair, and then Joy comes in losing her hair, they can both have different underlying root causes of it. So learn more about ECM. Learn more about Ellen Cutler method. Subscribe to my YouTube video, Dr. Ellen Cutler, and learn how you can improve your hair, your nails, your skin, and your overall longevity.